Hello and welcome once again to Ask Me Anything on Diabetes with me, Dr. Aniket Banvi. Well, I'm glad that it has been very progressive and you guys have been engaging with us in understanding and asking your curious questions on diabetes. Well, today I'm here once again with some more of those questions, which many of the diabetics have been asking us again and again. And let me address one of them here now. So the very first question that has been asked by an anonymous person is, what are the early warning signs and symptoms of a diabetes that individuals should be aware of? Well, this is a very good question. Reason, I believe that your body is constantly communicating with you, and it communicates with you in various ways. And I list down these things. What are the ways it communicates with you? When there is uneasiness, when there is discomfort, when there is no normal functioning, or there is some kind of an fluctuation in your blood sugar level or in your body entirely, you will definitely see a kind of a warning sign that your body wants to communicate with you, says that there is something problem which is going in your body, and this is why you're going through these things. And coming specifically for a diabetic, it will be increased thirst. Many diabetics go through this process where they feel, they are thirsty, they constantly need to drink water. And followed by this, when there is an increased amount of thirst, leads to frequent urination also. Now, I believe that these two things, the thirst and frequent urination, are both a loop, a constant loop, which puts a diabetic in a very uncomfortable and in risk position. And let me explain and decode it for you furthermore. Now, how does that occur? Now, whenever your blood sugar levels crosses 180 mg per dl, there is a signal which is being sent to your, the center of thirst. It increases your thirst level, the centers are activated, and you immediately lead or go forward to drink x amount of water. I have seen diabetics gulping at least half a liter to a liter's water at a stretch. When they lift a bottle, when they take water, they are completely using at least 500 to 1 liters of water, because they are that thirsty. And leading to that, what happens is that when that person is thirsty, when he drinks x amount of water, the water molecules goes and binds with the excess amount of glucose molecule which is circulating in your blood vessels, and it is taken to the kidney and it is thrown out, saying that, see, your blood sugar levels are extremely high and it is not necessary for your body, it is going to harm your body, let us throw that out. And that is how a constant frequent urination and the loop of thirst goes on again and again, and the person is then that same loop. Now, there is a good thing and there is a bad thing to this. Yes, your body is helping to throw out the excess amount of glucose from your body, and that is the fantastic thing about it. The worst part of it is that when it is throwing the glucose, it is not just throwing the glucose but also the nutrients that was being carried through in that glucose. There are nutrients, vitamins, minerals, all those things are also going out of your body. So you will, this all leads to further more complication, where a person might feel lack of energy, and feel because of lack of energy is also low, and fatigue, the person might feel tired because of this whole process. When it goes again and again, it's a constant loop that person goes through, and that is the painful part of it. Now, eventually, as this all goes on, there are some more signs that your body is constantly talking to you. If there is an weight loss, if there is a drastic weight loss that you see. Now, unfortunately, if you're thinking that it is just a weight loss, you are wrong. It is not just the weight loss, it is also the muscle mass which is being reduced. The muscle mass is being reduced, the muscle bulk is also being reduced, and this is the very harsh truth of a diabetic, because your muscles or muscle cells has the ability to metabolize and utilize the glucose. And when there is no muscle mass, when there is no muscle mass, what happens is that your glucose upregulation and utilization is going to be decreased, and furthermore it leads to increased blood sugar level again. So that is why if you see strength training, not just cardio but strength training, is also very essential for a diabetic to manage this in the long term. Leading to that, this there is another thing that constantly happens is increased hunger. A person might feel very hungry because the glucose which was supposed to be entering your cell is exiting your body through frequent urination or through the constant weight loss that is happening. So you're not getting the right amount of nutrients that is required, and your body thinks that you need to eat more so that you compensate that amount of nutrient, and that is why the hunger level, that is why you feel very hungry. And all this is a constant loop that goes on and on. So you need to understand that if you are going by chance any of these signs and symptoms, check your blood sugar level, check your HbA1c levels, so that you understand where do you stand, if you are a diabetic or a pre-diabetic, or what is the case scenario, and take those right decisions according to that. So this is what you need to understand. This is how your body communicates with you when you are having a high blood sugar level. And these are the warning signs that your body is constantly talking to you and asking you to help us. And I hope you help yourself by understanding that these are the things that your body is going to communicate. In this way, it is going to communicate. Let me move to the next question now. Now, what role does a regular monitor blood glucose level plays in diabetes management? Well, let me answer majorly three things. One is it helps you in the early detection. Monitoring your blood glucose level every 3 months to 6 months is ideal, I would say, just to have an understanding of how you're taking care of your health. And HbA1c every 3 months or 6 months, check definitely the HbA1c, also the postprandial blood sugar level. This gives you a vast understanding of how was your past 3 months of glucose metabolism working in your body. And the ppbs will help you in understanding whatever you eat, how is it being metabolized, how it is being regulated, how are the foods broken down, and is it being utilized by the cells or not. So you will have an understanding of this also. Now, this is one part of it. We will have an early detection, we'll understand whether there is all of these things happening or no. The another part of this is that once a person is diabetic and he checks his blood sugar level every once in 15 days or once in a month, or if there is some uneasiness and discomfort that the person goes through while throughout his weeks, days and months, we can detect hypoglycemia. Most of the times when there is a hypoglycemia, person ends up in furthermore complications that is so painful, especially for a diabetic. And it can lead to an extent where a person might fall into coma or many other complications, stroke and many other kind of issues. So you need to understand that when you regularly check your blood sugar level, you will understand whether you are in a hypoglycemia or hyperglycemia. Hyperglycemia is increased blood sugar level, hypoglycemia is decreased blood sugar level. And it is very concerning and very you know thought provoking, because hypoglycemia leads to a lot of complications. So regularly checking your blood sugar level will definitely help you in getting to know whether you are in hypoglycemia or hyperglycemia. That is the second thing about it. The third thing is that when you are constantly checking your blood sugar level, I mean to say once in 15 days, once in a month, and if there is a discomfort at any point of time, you can check it also. That is a random blood sugar level that you can check. If there is any discomfort and there is kind of an uneasiness that you're going through. And what happens is that studying these things, you will be able to reduce and also avoid the long term risks or consequences that might be, you know diabetic neuropathy, diabetic retinopathy, diabetic nephropathy, and all these complications that we see, kidney damage, heart damages, blood fluctuations, arterial damages. All those things can be avoided if you are constantly checking it. The only answer is not constantly checking, but once you check, if there is any signs of those things, you have to take the measure by altering your lifestyle, by changing certain things in your food habits, the way you live, and that is how you can correct them. This will only help you show your direction, saying that, see, this might be the way where you will end up. You might may end up in kidney diseases. You might may end up in, the nervous system diseases, or the nervous system collapsing, the neuropathy, the nephropathy, neuropathy, all those things. The tingling sensation in your hands and feet can be a indication that there is some fluctuation in your neuropathy. Kidney damaged, frequent urination again and again, the nephropathy, we will be understanding how it is happening. So these are the compass that you should be using to correct your lifestyle. When you check your blood sugar level, it is a compass which is telling you what is your current health scenario, and you should direct yourself in that direction, correct it, and make sure that you take care of your health in the long term. So these are the rules when you monitor your blood sugar level constantly. Now, there is a good side and also there is a bad side. Right now, when whatever I spoke is the good side. There is one bad side, that is what I feel most of the times. That is when a person constantly is behind the numbers, checking again and again, again and again. He's also in a pressure of being trying to being in that closed number game. The number game is somewhere that diabetic should be having 120 to 140 is the normal, and sometimes there might be your blood sugar level might be 110, 112. There might be some cases when there is 150 and 158 also. There might be both the spectrums. Now don't get panicked at that point of time when you check. Now, the reason is because when you do this, when you constantly are just 15 minutes after, 15 minutes after, if you're checking, constantly obsessed about the number, it is also putting you in a pressure where you are under stress, and your sympathetic nervous system, which is a stress activated system, if it is prolonged for a longer duration, you will see the stress hormones being released in your body and leads to many other further complications. So please make sure that you understand why it is necessary, how much should you put yourself in that, and how to use this compass when you check your blood sugar level, when you have your glucometer in your home. And that is how you can understand that. So make sure that don't go to any extremes where you're constantly checking your blood sugar level every hour, because that is not going to help you manage your diabetes. Correction of your lifestyle is going to manage your diabetes, not by just checking every 15 minutes, 20 minutes. Do the correct thing than just looking for the result. If you want the result, keep that, constantly checking urge aside, and focus on doing some kind of a physical activity, correcting your food habits, understanding why are you going through this, what are the things that should be changed. So you should address what is the root cause, not just seeing the superficial thing that is telling you that it is again high, it is again high. What is that wrong that you're doing? Where is the correction that you're supposed to do should be studied thoroughly. And this is how you can manage your blood glucose level in the long term, by with the help of monitoring your blood glucose level. Great. Let me move further. Now, this is the last question that we have, and I'll be answering this. How does diabetes impact other aspects of health, such as cardiovascular health and kidney function? Well, before that, we need to understand that when I say cardiovascular health, you know, heart is a pump which helps in circulation of blood throughout the body, and also collection of the body back to the heart, and purify it also. So this is a complete machine that is constantly working. In this process, it has a pipeline, it has a varied structure. If you can take your hand and see if you are seeing some kind of a purplish greenish veins, it is the deoxygenated blood which is being carried throughout the body. And there is one more pipeline, I would say, that is carrying oxygenated blood throughout the body. About coming to heart and blood, when these pipes are being damaged, it will leads to a lot of complications to heart and to your body also. What are these things said as? There might be atherosclerosis, that is development of the plaques, narrowing of your blood vessels. Your blood vessels, the pipes that I'm speaking about right now, what you see in your hands, have the ability to expand, that is dilate and vasoconstrict. Vasodilation, we say vaso means the blood vessel, and vasodilation, vasoconstriction. So it is having this ability to expand, to send the x amount of blood throughout the body. Now, this is one thing. The second thing is that it also leads to high blood glucose level, and leading to that high blood pressure also. High blood pressure, when I say that, the ability to expand and narrow is going to be decreased. The reason why we say it as high blood pressure is because the pipeline is this much and the pressure that is falling on this is extremely high, and it is not able to expand so that it can widen and pass the blood throughout the body in that force. And that is why you see increased heart rate, increased blood pressure, and all those complications. And that leads to the increased heart disease also. That might be again stroke, heart attack, and many other further complications. So diabetes is going to slowly damage many components. It will also might lead to erectile dysfunction, blood vessels damaging. All these complications are seen specifically if a person is diabetic and constantly in that same process where he is not able to manage your blood glucose level. Now, coming to this was all about the heart disease and the cardiovascular aspect of it. Now, coming to the kidney aspect of it, what happens is that we see diabetic nephropathy, where what happens is that your kidneys are not functioning at their optimal level. They are damaged. The processing, reabsorption, and excretion of waste products is not happening properly. The function has been reduced over a period of time. We also see the glomerular filtration, kidney, the rate of which it filters the units are also being damaged. The processing of all those factors that I told just now leads to chronic kidney disease, loss of kidney function, and leads to high blood pressure and many other furthermore complications also. So you need to make sure that correction of your health, taking care of your health by the way you live, which we call it as a lifestyle, the way you eat, the way you be physically active, is all going to contribute. And when I say this is not all about it, you need to study your own body, and that is a constant process that you should be in, and which will help you in the long term to manage your diabetes. Well, I've answered all these three questions, which were been asked by various people and which we were very curiously looking forward to know. And we'll be coming again on Wednesdays, every Wednesdays, answering such questions which has been brought by various people to us. What you need to do is that if you are looking forward to know and understand more with us, there is a link in this post. You can register to the webinar that we are going to conduct on every Saturdays, and I will meet you there and elaborately discuss on furthermore things that has not been asked here, or that has been looking forward to be asked also there. So I will be there looking forward for you. With that, I'll take a leave. Have a great evening. Take care of your health. And with that, I'll sign off.